think everyone's met me. I'm Dr. Katie Davis, and I'm the owner of Vision Therapy Institute. So I'm so excited to share a little bit with you all about what we do here in our office and how vision therapy and vision could help you or your child. So I put together a little slide deck here. Let's see if we got a couple more stragglers coming in. We'll let them in as we go. So I'll go over some information. If there's any questions anyone has, please, this is casual, let me know. And this is the first time I've done anything like this, so any of your feedback is welcome. So I'm gonna make sure I can share my screen here. All right. Caitlin's students, y'all let me know, does that work? The young folks helping me, can you guys see everything?
Yes, we can.
Fabulous. Hello, our joiners that just hopped on. So excited you're here. We will just kind of get started sharing a little bit about vision therapy in our office. And then if there's any questions, please feel free to interrupt me or we'll have a few moments to chat at the end. We have an eclectic group with us today. So I did my best to make sure I could speak to everything that everyone might be experiencing. So let me work on. There we go. Let me just do a couple last minute admin things. All right. So if you have any questions or anything, please feel free to unmute yourself, or like I said, we'll have some time at the end. So vision can be a key piece to a struggling learner's journey or a person with a brain injury. So my goal today is just to talk a little bit about more about how vision as a whole can help you or your child on the road to recovery. So a lot of times when patients come to our office, as a society, we think of vision as a really simple process. We think that if we can see something, our vision works just fine. So I really like this definition from Dr. Padula. He works with our organization that focuses on vision and brain injury. And he describes vision as a dynamic, interactive process of motor and sensory function mediated by the eyes for the purpose of simultaneous organization of posture, of movement, of spatial orientation, manipulation of the environment, and to its highest degree of perception and thought. So there are two different main processing streams that we consider when we're thinking about vision. We can consider what is it, and we can consider where is it. And our what is it visual processing is really what we're using when we get our eyes checked for a regular basic eye exam. You're sitting still, your head is still, you're reading letters across the page, and that's isolating that one what is it pathway. When you are told your vision is 20/20, all that means is that at 20 feet, your eyes can see a certain size letter. And as that 20 number gets bigger, your eyes need to see a bigger letter at that same distance. So it doesn't really tell you anything more except for, can you identify what something is and what size can you identify that? So most people, I think everybody on this call has 20/20 vision. So can you see what's in this picture? Have you seen this trick before? So if 20/20 vision is all we need, then what is this? Let's see if I can be fancy enough to get my little pen here. All right, so this is a cow. So we've got the cow's ears here. We got another ear here. We got some eyes here. So hopefully you guys can kind of pick out the cow's face there. But you have to have visual processing skills in addition to normal eyesight to be able to perceive this image. So the where is it processing stream. Oh, we're going to be stuck with those drawings on there. Let me see if I can figure that out. Well, we're going to have to roll with it. Let's see. There we go. I'm getting this Zoom thing. Okay. So our where is it system helps us identify where things are in space. So our what is it system tells us what the object is, maybe information about color, texture, detail, shape, or size. But our where is it system tells us where the object is, it gives us information about movement, spatial transformations, or spatial relations. So I really like the idea of this pyramid when we're thinking about our different models of vision. At the foundation, we have to have a healthy eyeball. We have to be able to see clearly. We have to have be able to move our eyes. The structures of our visual system has to be intact from the eyes all the way back throughout the brain. After we have that foundational skill, we need to be able to fixate with our eyes, to focus, to change focus from near to far. We need to be able to move our eyes across, and we need to be able to take the information from the two eyes and fuse that together. We need to be able to take the information from that where is it pathway and that what is it pathway and integrate that together. And that is really important, especially for our brain injury patients. We need to be able to take that information and then process it on higher levels, which we'll talk a little bit more about visual processing skills as well. And then once all of those levels of the pyramid are working efficiently, then we can have healthy development as a whole, and healthy performance. So when you come in for an exam in our office, we start with that foundational level. We're looking at eye health, eyesight, the structure of a visual system, and nearly all the optometric or ophthalmological exams you get in our community in particular do not really move much past that up the pyramid. There's some occupational therapists that we partner with that might start to screen for some of these higher level areas, but for the most part, we're just getting the bottom level checked. So to have a really complete sense of how a person's vision is functioning in its totality, we need to make sure we're evaluating all these different levels. So we're checking in our office to make sure the eyes are healthy. Then we check to see if the person can collect visual information. Then we might do an evaluation of visual processing as well. So we're moving up that pyramid. When you have breaks in those foundational levels, you need to get those levels remediated before you can move up to the next levels. This is from the American Optometric Association. This is outlining what that organization considers a comprehensive eye exam. So similar to that pyramid, we want to make sure we have good eye health. We want to evaluate a person's refractive status or if they need glasses. We're going to check that eye alignment. And in South Carolina, that's really where the extension of our requirements stop. We're not required to measure these fusion skills, the stereo vision, your eye focusing, your ocular motility. So again, the more in-depth evaluations can give you a better picture of how a person is using their vision as a whole. So let's talk a little bit about some of the dysfunctions that you can have when you're collecting that visual information. We've made sure the eye is healthy, that foundational level is solid. Now we're going to move up to that next level of the pyramid and look at how we collect the information. So the first skill we look at is the eye focusing. That's a person's ability to change their focus from near to far, far to near, to be able to sustain focus up close for a long period of time. Even patients that are coming in for comprehensive eye exams, they say, I have bad vision. We ask a little more questions and we find out the bad vision is only happening at the end of the day. A lot of times that's because of the eye focusing system, the muscle inside the eye that is responsible for sustaining visual attention up close for long periods of time just gets fatigued. So this is kind of a nice little graphic to show you what that might look like over time. Those are medically called accommodative dysfunctions. The next type of visual intake skill we look at is your eye teaming skills. And this is how well do the eye muscles move the eyes in and out in this pattern. So a very common eye teaming dysfunction is called convergence insufficiency. And you can see on the slide what would kind of happen if those two visual axes don't line up together perfectly, then you might have double vision. And a lot of times, especially for our younger kiddos, they're not reporting double vision like we would have two heads. They might report double vision or blurry vision as the letters just kind of slide past each other. Another very important intake skill is your eye movements. So this is your ability to move your eye from point A to point B or to follow a moving target. A lot of times kids with fluency issues with reading have saccadic dysfunction. And so it might look like words are moving up the page or going back down. And so they're rereading, losing their place while they're reading. This image is a uses an infrared eye movement sensor to show you what the eye movements look like in real time as a child was struggling with reading is reading across the page. The top paragraph is before vision therapy. The bottom paragraph is after vision therapy. So let's see if that's working. So you can see in that top image, that red line is just going all over the place. The kid is really struggling to get their eyes where they need to go. They're having to reread frequently. And if you're watching that struggle in the top paragraph, when you go by now, the after therapy, you can see the eye tracking has smoothed out. They're almost done with the paragraph. At the same time, that top child is on that third or fourth line of reading. So that can show you how difficult and how disruptive problems in those visual intake skills can be. After you have solid ocular health, solid visual intake skills, we would explore a person's visual processing. So there are a lot of different layers to visual processing, and then they all have to work together seamlessly. But some of the key areas we might look at are your visual spatial skills. So can a child recognize or write correctly oriented B's, D's, P's, Q's? Can a person analyze visual information reliably, like a figure ground skill, like a Where's Waldo book? Is that picture? Can you identify that relevant information from a busy background? How is a person's visual motor integration? So does their visual system integrate with their hand? How does their visual system guide their hand, whether that's through sports or writing? How about your visual verbal integration skills? How well is the language centers and the visual centers working together, as well as auditory visual integration, which is how your auditory processing and your visual skills work together. This is a really nice sample of how working on visual intake skills can directly impact that visual motor integration. So we can see the side with the handwriting that's really struggling with those spatial skills, spatial awareness, had trouble with those intake skills. And then after the vision therapy, when all of the intake skills and visual processing starts to come together, we can see our handwriting smooth right out. There are two higher level visual intake and visual processing deficits, and those are called amblyopia and strabismus. Commonly, those are referred to as either a crossed eye or a lazy eye. Amblyopia is a neurodevelopmental disorder of the brain that manifests through the eye. So we often think of amblyopia as a deficit of eyesight, but it's really happening at the level of the brain, and it's influencing depth perception, tracking, and so much more. So there's different levels of that. And strabismus, there's a few different types of strabismus. You can have an eye that turns in, an eye that turns out, up or down. Traditional care, when you Google or look into treatments for amblyopia and strabismus, they really are focused on the eyesight. But that ignores all those other visual intake and visual processing skills that we just talked about. As you can guess, two eyes are better than one. We have two eyes for a reason. And there's over 150 papers that demonstrate the evidence for binocular treatments as superior to patching or surgery alone for the remediation of these conditions. So, question I get asked a lot, I still don't have a great answer for this one, but why is the standard of care still patching and cosmetic of the eye muscles through surgery when there are so many studies, an entire 2-hour lecture I've done before on the importance of stereo vision and depth perception for quality of life with patients with amblyopia? Time and time again, studies show us the lack of depth perception significantly impacts quality of life, whether it's driving, walking, body posture in general. I really like this slide, just to change topics a little here about division and learning. I gave a presentation to the International Dyslexia Association a couple years ago, the South Carolina chapter, and I happened to hop on for the person presenting before me, and they were discussing this Scarborough reading rope, so all the different threads that go into a person's ability to read. And if you look down at the bottom, there's one little thread called sight recognition. And lecturer was speaking about how difficult it was for them to nail down this thread of how that impacts reading. And that's visual intake skills. There's more and more studies now coming out that show kids with dyslexia have a higher incidence of these visual intake and visual processing deficits. And there are some small studies that show vision therapy is effective for remediating these deficits as well to help reading. And so you just begs the question, how many of kids with dyslexia may be misdiagnosed, but also how much are these vision deficits influencing the effectiveness that these other dyslexia-based interventions can do if you still have struggles with the visual intake skills. Let's see this here. So what are some of the signs of a vision problem? A person can be squinting, they can rub their eyes, have tilting, problems with eye-hand coordination, reading fluency, reduced attention and concentration, of course, blurred vision, headaches, eye strain, red eyes, trouble with judging different distances, and losing your place. And vision for kids who struggle with learning often can be a hidden link to that struggle. 15 of the 18 symptoms of ADHD are also associated with functional vision disorders. 13 of the symptoms of dyslexia are associated with functional vision disorders. And this is a little summary of what some of these visual skills are that a person would need in the classroom. And only one of these columns have anything to do with eyesight. The rest are more eye focusing, eye alignment, depth perception. So we're going to switch gears a little bit and talk about vision and brain injury. Depending on the study that you look at, there's anywhere between 30 to 70% of patients with a brain injury have some sort of functional vision deficit associated with their recovery. 50% in this study had eye focusing dysfunctions, 50% had eye teaming dysfunctions, and 30% had eye tracking dysfunctions. 14% of patients in this study had deficits in all three of those domains. So these visual skills are crucial for many patients in recovery. And a lot of the symptoms for brain injury are much more subtle than patients maybe who have these developmental vision disorders. Patients with brain injury may report fluctuation in their vision with the problems with clarity and comfort. They may report more instability of print when they're reading versus the overt double vision. They, of course, will report light sensitivity, may have more dry eyes, trouble with depth perception, and have reduced reading speed. And a lot of these skills are related to how the brain is processing that spatial information, not the eyesight. You can also have something occur called visual snow, where your visual may show up like black dots in your vision, where you can have kind of static in your visual processing. And so you still require some help with those parts of your visual brain to get that system to return to normal. And I really like this image. This is actually a still image. If you look at the picture in the bottom, the little drawings at the bottom, it seems like the walls are moving. It's not a video. And what's that showing us is often happens with a brain injury with visual deficits is the information that's coming through that central what is it channel is not syncing up anymore with the information coming through that where is it pathway. So a lot of kind of funny things happen when you can't trust your vision. And again, often these patients have 20/20 eyesight. So let's see, this is gonna take, we may save this one and come back to this because this may hop us out of here. Let's see if this works.
At any one moment, we are being bombarded. Our brains do a remarkable job of making sense of it all. It seems easy enough to separate the sounds we hear from the sights we see. But there is one illusion that reveals this isn't always the case. Ba, ba, ba. Have a look at this. What do you hear? Ba, ba, ba. Ba, ba, ba.
All right, let me see if I can get this image sharing working a little better for you guys. I would love for you guys to see this video. This video is one of my favorite demonstrations for showing how vision can really influence all of our other sensory systems. So let's see if this will work for us. Let me back you up a little bit here just so we can see.
Ba, ba, ba. Have a look at this. What do you hear? Ba, ba, ba. Ba, ba, ba. But look what happens when we change the picture. Ba, ba, ba. Ba, ba, ba. Ba. And yet, the sound hasn't changed. In every clip, you are only ever hearing ba with a B. Ba, ba, ba. It's an illusion known as the McGurk effect. Ba. Take another look. Ba. Concentrate first on the right of the screen. Ba. Now to the left of the screen. Ba. The illusion occurs because what you are seeing clashes with what you are hearing.
In the illusion, what we see overrides what we hear. So the mouth movements we see as we look at a face can actually influence what we believe we're hearing. If we close our eyes, we actually hear the sounds as it is. If we open our eyes, we actually see how the mouth movements can influence what we're hearing. Ba, ba, ba.
It's a bizarre effect. Remember, the only sound you're hearing is ba with a B.
Ba, 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 ba.
What's remarkable about this illusion is even knowing how it's done doesn't seem to make a difference.
Ba. The effect works no matter how much you know about the effect. I've been studying the McGurk effect for 25 years now, and I've been the face in the stimuli. I've seen stimuli thousands and thousands of times, but the effect still works on me. I can't help it. The speech brain just takes in that information and doesn't care about what outside knowledge you bring to bear. Ba, 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 ba.
The McGurk effect shows us that what we hear may not always be the truth.
Ba,
But it also helps us to understand what happens when our senses conflict.
ba, ba, ba. When the brain has the conflicting information, it tries to make sense of that conflict. And depending on what type of modality is providing more, I guess, salient information, that information might override or at least combine with the other information.
Love that demo. Let's see if I can get back to our slides here. Oop. It really shows us how much the visual information, when it's not working well, can influence in the classroom and in other places. So let's see. So what do we do when our visual system is not working optimally, where we're not able to collect the visual information like we need to? It's influencing those other senses. You may be struggling with reading, walking through space, driving. That's where vision therapy comes in, where we take your symptoms or your areas of deficits and select specialized activities to help improve them. So what we're looking at when we're planning a therapy program is we're looking to make sure that the goals that each person has is considered when we're planning each activity. So knowing what a person wants to get out of their therapy program really helps us to make sure we're selecting appropriate activities. We know the brain likes novelty, so we're making sure there's some variety, but we also know the brain needs practice to learn these new skills. So we're looking for the variety and repetition. Every activity that we're doing in the therapy room is giving the patient feedback. So if you're having trouble moving your eyes in this direction, we might be selecting a tool that shows you that. And that works in every area of those visual intake skills as well as processing skills. And we're challenging the sensory parts, so the brain parts, and then the motor part, the muscular parts of our visual system, to what we call develop degrees of freedom between the two. So the ability to change one thing and hold something else static, hold something else the same, we're developing the ability to those to work together. And we're getting all the different sensory parts of the brain to work together. We know the more lasting change occurs when you get different parts of the brain to work with your vision with each other. So for many patients in the beginning, we're really stabilizing their visual system. So that might look like for a person with a brain injury, to get their eyes comfortable again, or a person with trouble with reading, just practicing those simple acts of moving your eyes from point A to point B, the most basic skills we need to be mastered before we move up to the higher level. A person with a crossed eye or a lazy eye, we may work on actually building binocularity first, because we know the more you can turn on the binocular parts of the brain or the two-eyed parts of the brain, everything else will fall into place after that. Then we work on making all of those visual skills automatic and integrating them together with the other parts of the brain. I really like this imaging study here. It really shows what we're doing when we're trying to get the eyes to work better together in a more organized fashion. We're recruiting more of your brain to become more effective with the visual system. So you can really see that before and after of how much more brain architecture we're recruiting when we improve our eye movement skills. So I included some more resources here for anyone who wants to learn more. If there's any questions or anything that anyone would like to talk about from here, I would love to do that. Thank you so much for joining us tonight. I hope this was helpful.